Hello, my dear fellow veterinarians. Today, in the last lectures, we have completed our two main diseases in case of the canines and felines. Now, in this lecture, we will be dealing with diabetes. Okay, mainly diabetes mellitus. This is a very important disease in canines and felines, and also very important from your examination point of view, as well as important for the clinical practice. Okay. First of all, in order to understand this diabetes mellitus, let me give you a brief review about the anatomy of pancreas and a little bit of physiology of these pancreatic enzymes and what is the exocrine physiology of pancreas and endocrine physiology of pancreas. Okay, suppose this is the pancreas. Okay, in the pancreas there are the cluster of cells, cluster of cords. Okay, pancreas. Okay, in pancreas are perform dual function. Okay, means pancreas have the exocrine part and an endocrine part. Okay, exocrine part and endocrine part. Exocrine part is responsible for the production of digestive enzymes. Okay, digestive enzymes like trypsin. Okay, this trypsin, it helps in the digestion of food in small intestines. Okay, the endocrine part of pancreas, it contains three types of cells. It contains a cluster of cells which are known as islets of Langerhans. Okay, inside these islets of Langerhans, we have three types of cells: alpha cells. Okay, we have beta cells, and we have delta cells. Okay, alpha cells secrete, these are responsible for secretion of glucagon hormone. Okay, since this is the endocrine part, so alpha cells will secrete glucagon. Beta cells will secrete insulin. Okay, insulin. And delta cells are responsible for secretion of somatostatins. Okay, this is a little bit of the physiology of pancreas. What are its cells and what is the secretion from different cells of endocrine part of pancreas. Now, what since let me discuss a bit regarding the normal physiology of insulin. Okay, when the beta cells inside the pancreas, they secrete what is known as proinsulin. Okay, since this, what is this proinsulin? It is the precursor of insulin. Okay, this proinsulin, it will be metabolized into insulin, that is the active form, and C peptide. Why I am discussing it here? Because this C peptide is important for the diagnosis of, in order to measuring the whether there is the normal concentration of insulin produced in the canine and feline body, or there is deficient concentration of insulin produced in the canine and feline body. So how it will determine the concentration of insulin? Because if the C peptide unit, for example, it is of 10 units, okay, in the body, okay, in the circulation of canines and felines, thus the insulin concentration shall be 10 units also, because their precursor is same. Sometimes what happens that in some cases of, like, if there is cancer of this pancreas, insulinoma, okay, what happens in the insulinoma, there will be the increased concentration of insulin, okay, but these C peptides will be in the normal concentration, okay. So this C peptide will help you in determining the whether the insulin is secreted in the larger amounts or whether the insulin is secreted in the lesser amounts, okay. But here you have to remember one thing, that this C peptide, it is degraded or metabolized in kidneys, okay, in kidneys. So whenever you are dealing with a case of renal failure at that time, you must expect that there will be the increased concentration of C peptides. Why? Because the C peptides are normally metabolized in kidneys whenever there is the abnormal functioning of the kidney. So these C peptides would not be metabolized, so their concentration will increase, okay. So here you have to remember this thing, okay. So this is the normal, this physiology of insulin, and what is the function of insulin, okay. I'm just recapitulating your you already know these things, but in order to start our main topic, that is diabetes mellitus, we must be aware about the functions of insulin. Whenever in the body, the main function of the insulin is transportation of glucose from blood, okay, to cells, where it is used for the ATP generation, means energy production. So this is the normal. Suppose this is a cell, okay. This cell contains special type of receptors, okay. It contains a special type of receptors. Now what happens when the insulin, this is the blood circulation, okay, this is the blood circulation. In the blood circulation, these red dots, these represent the glucose molecules. So what happens that whenever there is the presence of glucose in the blood, at that time the insulin is secreted from pancreas. So these insulin molecules will bind to these receptors that are present on the cells. When these receptors are activated, these receptors will lead to the transportation of these glucose molecules inside the cells, okay. And these glucose molecules inside the cells, they will lead to the production of ATP, that is the production of the energy. So this is the normal mechanism. Now what happens in the diabetes, you know that diabetes mellitus, normally this is in layman's language, we can say that diabetes mellitus, it is characterized by hyperglycemia, okay. It is characterized by hyperglycemia. Diabetes mellitus is of two types, okay. One is type 1 diabetes mellitus and type 2 diabetes mellitus. Type 1 diabetes mellitus and type 2 diabetes mellitus. In type 1 diabetes mellitus, the main reason is that there are different reasons in canines and felines. Let us discuss them one by one. That what leads to the type 1 diabetes mellitus, means what leads to the hyperglycemia in canines and felines. The first reason is autoimmunity. What happens in the autoimmunity? There is suppose this is the pancreas, And against the pancreas, in the pancreas I told you there are the cluster of endocrine cells that are known as the islets of Langerhans, and inside these islets of Langerhans there are beta cells that secrete the insulin. So in the autoimmunity there is the production of auto antibodies. There is the production of autoantibodies, and these autoantibodies are produced against the islets of Langerhans. So it leads to this destruction of these islets of Langerhans that will lead to the decrease in production of insulin. Okay, so there is decreased production of insulin. Star it. Let us star it. So this is the first reason, that is autoimmunity. The second reason in type 1 diabetes mellitus is, in case of the canines and felines, since you must remember here one thing, in case of the dogs, type 1 diabetes is maximally found. Okay, you will mainly see the cases of type 1 diabetes mellitus. So first case of diabetes mellitus is autoimmunity. The second case of diabetes mellitus in case of the canines and felines is hormonal antagonism. What happens in the hormonal antagonism? Let us discuss it. You must remember one thing, that the canines are non-seasonally, okay, these are non-seasonally monoestrous. What does it mean? It means that in case of the canines there is a luteal phase of 60 days, means there is a period of distress. There is a period of distress in distress of 60 days in case of the canines. Okay, and during this distress there is the increased production of progesterone. Okay, so remember, this production of this progesterone hormone, it has been seen and it has been established that it has an antagonistic role on insulin. Means whenever the female dogs, these are in the distress phase, so at that time they are at the increased risk of diabetes mellitus. Why? Because there is the increased production of progesterone, and this progesterone has an antagonistic role on insulin. Okay, means let us start it. So this is the second reason that will lead to the decrease of insulin in canines. Okay, and remember here one thing, that you must remember here, that whenever the female dog is diabetic, okay, here is a clinical point, whenever the female dog is diabetic, it is mandatory to go for OVH. Okay, why? Because if the female dog is diabetic and it will be entering into the distress phase, it will further lead to the increased production of progesterone, that will further decrease the insulin and will aggravate the diabetic condition more. So it is mandatory to go for OVH it is recommended that all the female dogs shall go for OVH as the diabetes mellitus is diagnosed. Okay, further, when these female dogs are in the distress phase, the mammary glands of female dogs secrete growth hormone. Okay, secrete increased concentration of growth hormone, and this growth hormone is again antagonistic on insulin. Okay, are you getting me? So this will further decrease the insulin level in the female canine body. Okay, now The third important cause in case of the type 1 diabetes mellitus in case of the canines is that is hyper hypercortisolism. Hypercortisolism, what does it mean? There is the increased production of cortisol. Since what are the conditions in which the cortisol is created? It could be stress, when the dog is obese. Okay, these are the conditions that lead to the increased production of cortisol, or dogs with hypercortisolism. Or there will be the pituitary gland tumor gland, or adrenal gland tumor. So since this cortisol, it is created from the adrenal cortex, so whenever there is any tumor in the pituitary gland or in the adrenal gland, or the dog or cat is in stress, or the dog or cat is obese, it will lead to the hypercortisolism. Okay, and this increased cortisol, it again has an antagonistic role on insulin. So whenever there is increased production of cortisol, that will decrease the insulin concentration. Okay, this is another risk of this is another reason that leads to the decreased levels of insulin. Now the fourth cause in case of the production of type 1 diabetes mellitus is, here you must remember one thing, that sometimes we use systemic glucocorticoids. Okay, corticosteroids are given, so these glucocorticoids, they further increase the risk of diabetes mellitus in dogs. Why? Because these are corticosteroids, they have an antagonistic role on insulin. So I will be later discussing that how this decrease in insulin leads to the diabetes mellitus, or you yourself may understand this, that in all these phases, like here in autoimmunity there is decreased insulin, in hormonal antagonism how there is decreased insulin concentration, in hypercortisolism how there is decreased, or in systemic glucocorticoid therapy there is decreased insulin. Whenever there is decreased insulin concentration, as I discussed here, what will happen? Since these receptors will not be activated, when they will not be activated, they will not lead to the activation of these glucose transporters, and so there will be decreased uptake of glucose from blood to the cells, and it will lead to the hyperglycemia, means it will lead to the diabetes mellitus. Okay, so one more cause for diabetes mellitus in case of the canines and felines is pancreatitis. So what happens in the pancreatitis? In the pancreatitis there is inflammation of pancreas. Okay, means when pancreas become inflamed, what will happen? Here is a cage, just keep your concentration. Okay, in pancreatitis there is inflammation of pancreas. So what will happen here? Whenever there is inflammation of pancreas, the exocrine portion leads to the excretion of trypsinogen. Okay, and the trypsinogen is converted into trypsin inside the pancreas. Okay, normally what happens, this trypsinogen will go to the small intestines, and there it will be converted into the trypsin, and then it will help in the digestion of food. But here in pancreatitis, what happens there, this trypsinogen, that is the precursor of trypsin, it is metabolized inside the pancreas, and this trypsin, wait a bit. So what happens here, that this exocrine portion of the pancreas, since there is the production of trypsinogen, and normally this trypsinogen, when it goes to the small intestines, it is converted into the trypsin, that is the active form, and it helps in the absorption of digestion of food. Okay, this is the normal function. Now what happens here, since in the pancreatitis there is inflammation of the pancreas, this trypsinogen is converted into the trypsin inside the pancreas, and it leads to the, what it does inside the pancreas, it is cleaved inside pancreatic acinar cells rather than the small intestines. And this active form of trypsin, what it does, trypsins are released within the pancreas, okay, and these trypsins cause the local tissue damage, okay. Okay, so this is the one reason. And when it leads to the tissue damage, what will happen, it leads to the destruction of these beta cells and leads to the decreased production of insulin. There are some proteases, it has been found that there are some proteases. For example, there is a protease that is known as alpha 2 macroglobulin. These alpha 2 macroglobulins, what it does, these alpha 2 macroglobulins, these regulate the function of these enzymes, okay, like trypsins, okay. It regulates these alpha 2 macroglobulins, these regulate the function of these trypsins. And in the pancreatitis, these alpha 2 macroglobulins are not produced, okay, these are not produced. So this is the another reason that pancreatitis leads to the decreased insulin production. So one of the reason is what happens that there is the in situ production of trypsin that leads to local tissue damage, and another reason is that there is the decreased production of alpha 2 macroglobulins. And what are these alpha 2 macroglobulins? These are the proteases that are important for the functioning of these enzymes, okay. These are the important reasons that have been found that are responsible for the responsible for the type 1 diabetes. And also remember that those dogs and cats that are obese, that are older, okay, and female dogs, they have been found what, they have been found at the increased risk of pancreatitis, okay. And there is a breed of dog called spaniels, these are also at the increased risk of pancreatitis. And there is a term, that's known as EPI. What is EPI? EPI is exocrine pancreatic insufficiency. What is exocrine pancreatic insufficiency? What happens in the chronic pancreatitis in case of the canines and felines, okay. When we will dealing with the pancreatitis, I will explain each and everything, but here you have to remember that in chronic pancreatitis there is the EPI, that is exocrine pancreatic insufficiency. What happens in the exocrine pancreatic insufficiency? The name itself suggests that there is the insufficient production of digestive enzymes, okay. When they like trypsins, so there will be decreased digestion of food, okay. When there will be poor digestion and absorption of food, what will happen, it will further lead to the, it will make diabetes mellitus very difficult to treat, okay, to control, and it leads to the dramatic weight loss. What I am actually trying to make you understand that in chronic pancreatitis we have seen it leads to the decreased insulin production. One of the another phase of this chronic pancreatitis, it leads to the EPI, that is exocrine pancreatic efficiency. What does it mean? It means that there is the insufficient production of digestive enzymes, that is the trypsin. Like for example, the trypsin, when there will be decreased production of these enzymes, there will be decreased digestion of food. And when there will be decreased digestion of food, what will happen? It will make this diabetes mellitus very difficult to control. And because of the decreased digestion and absorption of the food, there will be the dramatic weight loss, okay. So, and what about the age? And remember, type 1 diabetes mellitus mainly seen in case of the canines, canines, and seen in middle-aged and older dogs. Okay, mainly 5 to 12 years of age. So this is about the type 1 diabetes. What is type 1 diabetes? What are the different reasons in case of the canines and felines that are responsible for the type 1 diabetes, that is insulin dependent diabetes mellitus. Okay, now let us see about the type 2 diabetes mellitus. Type 2 diabetes mellitus. What happens in the type 2 diabetes mellitus? I told you that there are the special type of receptors that are responsible for the binding of insulin. Okay, what happens that these receptors become resistant. Okay, since in type 2 diabetes mellitus insulin production is sufficient, okay, and problem lies in these receptors become resistant, means they do not respond to the insulin production, they do not respond to the stimulus of insulin. And when these receptors become resistant, so there will be no transport of glucose from the blood. Okay, that will lead to the hyperglycemia. So the reason for it is, one reason that has been established is the alteration in metabolic profile. What happens that, what does it mean? It means that there are some dogs, in which dogs and cats that may be at that may be having decreased HDL level, increased triglycerides. Okay, they may be having increased VLDL level. Okay, so there will be alteration in the metabolic profile, and because of this alteration in the metabolic profile, these HDLs, these TGs and VLDLs and increased blood sugar, they bind to these receptors, and instead of binding to the insulin, these triglycerides, they bind with these receptors and make them resistant to the insulin. This is one of the reasons. Second reason is family history. Okay, means genetic, means hereditary. Okay, there is some mutation in these receptors, that's why they are unable to bind to the insulin. And these are the reasons for type 2 diabetes mellitus. So this type 2 diabetes mellitus not mainly seen in case of the dogs and cats, very rarely reported. Okay, so this is the brief introduction. I try to cover each and everything that is important for your examination point of view as well as for your clinical practice. Now, what are the complications of diabetes mellitus? In diabetes mellitus, you will be seeing polyuria, you will be seeing polydipsia, and you will be seeing polyphagia. Let us discuss how these three P's occur: polyuria, polydipsia, and polyphagia. This, what happens in the diabetes mellitus? I told you there is, in type 1 diabetes mellitus, there is decreased insulin production, and I told you the reasons. Because of the decreased insulin production, there will be hyperglycemia. Hyperglycemia means there will be increased glucose concentration in blood. Since this glucose is a hyperosmolar molecule. Okay, means because of this hyperglycemia, there will be increased osmolarity. Okay, there will be hyperosmolarity, and because of the hyperosmolarity, what will happen, since when the concentration of glucose increase in the blood, okay, it will make the blood more, it will increase the osmolarity of blood. When it increase the osmolarity of blood, it will stimulate the hypothalamic thirst center, and hypothalamic thirst center will stimulate polydipsia, means increased intake of water. Why? Because this glucose is hyper osmolar molecule, it increase the osmolarity of blood. Second is, when this glucose, since there is increased concentration of glucose in the blood, when it comes in the urine, okay, when it comes into the urine, it causes the osmotic diuresis. Okay, since this is an osmolar molecule, when its concentration in the urine increases, there is glycosuria, it causes the osmotic diuresis, and it leads to the polyuria. Okay, means what does it mean? When it comes into the urine, these glucose molecules, these drag water from the circulation, and when these drag, because these are, when the concentration inside the urine increases, the glucose molecules inside the urine increase, these will drag the, since the concentration inside becomes hypertonic, and it will drag the water from the circulation and lead to the polyuria, means increased urine output. And because of this polyuria, there will be dehydration. Okay, and because of dehydration will further increase the osmolarity of blood, that will stimulate the hypothalamic thirst center and lead to the polydipsia. These are the reasons why in diabetes mellitus there is polyuria, polydipsia. Now, one thing, because of this hyperglycemia, what happens that, since I told you, there is decreased insulin production in type 1 diabetes mellitus, and despite being the normal concentration of insulin in type 2, in nutshell, the body cells are unable to utilize the glucose, they are unable to utilize the glucose. So body, what will happen, since body has to derive energy from other sources, it will shift towards, breakdown of proteins, okay, and fats, means there will be increased proteolysis and increased lipolysis, means body will go into the catabolic state. So when the body will go into the catabolic state, it will lead to polyphagia. So these are the reasons. This is one of the complication of diabetes mellitus, that is polyuria, polydipsia, and polyphagia. Why there occurs polyuria, I told you. Why there occurs the polydipsia, I told you. And why there is polyphagia, I explained each and everything. Now, in the next lecture, we will be dealing with diabetic ketoacidosis, how it occurs. Okay, we will be dealing with HHS, that is hyperglycemic hyperosmolar syndrome. Okay, what is the effect of hyperglycemia on potassium in body? Okay, we will be dealing with microvascular complications, we will be dealing with microvascular complications. Okay, in microvascular complications, we will be dealing with non-enzymatic glycation, that is how this in diabetes the patient is susceptible to the peripheral artery disease, coronary artery disease, strokes, MIs, myocardial infarctions. We will be dealing with that. And in microvascular, we will be thoroughly dealing with diabetic nephropathy, diabetic retinopathy, and diabetic neuropathy. And after that, diagnosis and treatment. So this is the basics regarding the diabetes mellitus type 1, type 2, and what are the different reasons in canines and felines. So revise it and wait for my next lecture. Till then, take care.